We work with health plans, large commercial health plans, Medicare Advantage plans, helping them scale and design specialty programs that actually bend the cost curve.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster with Bill Nordmark, CEO of Enlace Health. Bill, good to see you.
Great to speak with you, as always, Logan.
So, we've watched your progress for years. You guys are doing great. And one thing I love about it, your company, is that you are like a standard bearer for value-based care. You are pushing the market forward. So I want you to start by just giving us a 2024 overview of kind of where does value-based care stand in the market today?
Still in its infancy. I mean, as much as we're trying to... and as much as we're trying to push the flag bearer for it, the inertia of the market, right? I mean, still the challenges. One of the things that we're really excited about is specialty care is coming into the forefront, right? So the majority of the industry has been stuck in risk-based primary care as a quarterback. Only 25-30% of the cost is in that primary care space, 70% of the cost in specialty care. Where can value-based care really start to take foothold? When we're talking about specialty care.
Okay, so just to simplify this for our audience, you're saying like when we think of like a medical home, a capitated environment, we think about a primary care doctor who has one bucket of money to take care of a patient. And you're saying the real money is when they send them out to a neurologist, they send them out to a cardiologist.
That's right. So when you look at a primary care doctor's management of cost, only about 25 to 30% of the cost is in that doctor's office. Everything else goes out when they're engaging in specialty care, when they're engaging in ancillary specialty care, whether it's cardiology, MSK, oncology, maternity. That's where the big opportunities lie in value-based care. That's what we're tackling.
Okay, and remind me what kind of organizations you work with.
So we work with health plans, large commercial health plans, Medicare Advantage plans, helping them scale and design specialty programs that actually bend the cost curve. Go back to a long time ago. Airplane analogy, if you bought airplane ticket like you bought healthcare, you wouldn't pay for it up front, you'd get bills from everybody. We're changing that dynamic. That's the promise of value-based care.
So you're working with large population health companies like a Centene?
Yeah, so large, actually, Blues plans are our biggest set of customers. So large commercial payers that have a lot of opportunity to bend the cost curve with their high-valued specialists. Also, Medicare Advantage plans are starting to become a big opportunity for the market. As the promise of that primary care hasn't played out, now they're having to bend that cost curve in specialty care.
So make it really simple for us how value-based care works in the specialty clinic setting.
So the simplest thing that I can say is it is transforming from a fee-for-service or fee-for-volume dynamic to putting that specialist or that provider in a position where they care about cost and quality, right? And that outcome of lowering the total cost of care, picking the right location of service for the patient, and ultimately getting the best outcome.
Okay. So where are you at in the market today? I know you've raised a fair amount of funds. How much have you raised?
So we've raised about $100 million to date.
Not bad.
Not bad, and we're deploying that capital. Very excited about the future of where we're investing. Starting to invest a little bit on the health system side, as well as on the payer side. That's been our core business for some time.
What did you do with $100 million?
So, we've built a platform.
I asked that because, to back up, I interview startups all day, and many of them are trying to raise $600,000, $800,000, $2 million. And so you're in a different category. And so it's just helpful to kind of level set for our viewer. Why did you need the $100 million, and what does that enable a company to do at your stage of business?
Yeah, so, the key thing that you got to get to in healthcare is scale. And scale comes in a number of ways. When you have the first set of an idea, that's one piece of it as a founder or an entrepreneur. But when you go to scale and work with major billion-dollar Blue Cross Blue Shield plans or large commercial payers, there's an expectation of scale that those businesses have. We today manage programs in 13 states. We're doing 14 or 15 episode programs across GI, oncology, maternity, MSK, cardiology. Those are really big programs. They're big providers. They're big payers that we work with. A level of scale is required. So we've been very excited to launch that technology and also scale those programs so where the market can deliver on value-based care.
And help us understand kind of the piece that you play. Obviously you're not on the provider side. You're helping to create the bundles.
That's right. So we're there to design the value-based program, what is in the program, what's out. We're there to price the targets and set the outcomes that are expected. And we're there to help the providers achieve that and process and administer the programs. A big piece of what we've been doing lately is helping the providers understand performance, right? So one of the things we talked about, I think, a couple of years ago was providers need access to data. They also need to understand what actions get better outcomes and what actions don't get better outcomes. And that's been a big place for us to drive value.
Okay, a lot of talk at this conference about the role of AI, generative AI. How do you see that playing out in value-based care and in Enlace?
Yeah. So I think in the long term, AI is going to have a role. I don't think today that we know what that role is, right? I think there are some use cases around the access to data and transformation of data. The long-term value of AI is yet to be known. In the value-based care world, we do feel that there's going to be an opportunity in referral patterns and how do you drive outcomes for provider organizations. That's what we're looking at. But I don't think it's a panacea. I don't think it's like the end-all be-all yet, and I think we're still a little ways to figure out what that's going to be.
I mean, far from being the panacea, do you also see it as a risk? That's kind of what I'm reading between the lines.
I mean, any time you have something where you don't really know what the outcome can possibly be, it's both an opportunity and a risk, right? And so the one challenge that healthcare has is we always chase shiny balls. All right, we talked about this before. And I don't think that healthcare is in a position to revolutionize or transform. It just hasn't. It's going to evolve. And I think where we see it as an opportunity is we see the blocking and tackling we're doing today and the future of what AI can do inside that about value-based care is that evolution that will then transform the market. I don't think it's going to be an initial transformation out of the gate.
Kind of what I'm hearing you say is like what you're building, the pipes and the roads for how we need to pay for care. A lot of people have understood this is what we needed to do for a long time, and it's taken a long time to kind of do the basics, right? To get the basics right. So the idea that we're going to like leap forward to some space technology when we haven't done value-based care right yet.
Yeah, I mean, that's going to be the challenge, right? I mean, we're still paying the majority of everything fee-for-service. Some of our most successful customers are prospective arrangements. We've talked about this, paying providers up front for services and getting the value-based care promise. The bigger adoption of that is going to provide those rails that are needed. You put AI on top of that, that's the lighter fluid, right? That's what the game changer is. That's the way we're looking at AI. And so we're really excited about where we're at. I mean, the growth in prospective arrangements is growing. You put the provider at risk, you start getting the provider to be on the hook for the outcome of care, and that's where you start getting the transformation. You help them with AI and enhancements of data and access to data and to know what's happening faster. That's where you get the flywheel.
Love it. Bill, thanks for the update.
Absolutely.
Exciting to see what you're doing.
Always great to see you.
Wish you the best.
Thanks to Startup Health.
All right.